Health workers in Uganda are warning of the relapse of the strange nodding syndrome in several cases in the northern parts of the country. Nodding syndrome is a neurological condition characterized by episodes of repetitive dropping forward of the head and seizure-like activity such as convulsions or staring spells. Isabel Nakiria reports from northern Uganda.
Fiona Alonyo has battled nodding syndrome since she was 7 years old. Her mother says she was a normal child until she noticed the nodding signs, convulsions, and inability to talk.
Even the medical workers didn't know this condition. They were first treating malaria. It reached a point when she got a mental problem and would even run out into the bush until they discovered the disease and she started getting drugs. But during that time, she would even fall in fire.
The disease has affected Alonyo's growth, deforming and stunting her. It's also affected her ability to speak. Her mother says there has been a slight improvement, and at 22 years old, she can now eat by herself. She also walks, but with difficulty. Alonyo is one of over 3,000 cases of children affected by the nodding syndrome, first reported in Uganda in 2012. For 15 years, Lillian Akelo's family has struggled to provide special care for their helpless daughter who has severe nodding syndrome. Akelo has to keep a close eye on her because the attacks can be life-threatening. In the past, she's fallen on fire but survived with injuries. Alonyo's mother says the attacks are less frequent now, but it's still not safe to leave her unattended. But managing the condition has drained the family financially and emotionally. She has 7 other children to care for and no proper source of income.
I can't blame God because He's the Creator. If it is a trial, then I pray He takes it away. It has impacted on me negatively. Sometimes I break down emotionally when I see her convulsing, passing stool. I was not like this before. Now see, I've grown thin.
The cause of nodding syndrome remains unknown. Some studies suggest it's associated with river blindness, which is transmitted by the black fly that lives along streams. It causes visual impairment and rashes, which some victims of nodding syndrome exhibit. Akelo's family lives near the Aswa River in northern Uganda, where several other cases were first reported. It has also been linked to epilepsy and malnutrition deficiencies, but more research is still being done.
In the previous years, they used to supply a food supplement called an immune booster called Replenish. And the children were doing well during that time. But since the supply stopped, the children have relaxed.
Many of the families affected are unable to afford a balanced meal, leaving the victims with low immunity. Currently, the disease is incurable and can only be managed by suppressing the symptoms. No new cases have been reported for over a decade, but health workers are concerned some of their patients are not receiving the proper medication.
As health workers, we go there, we go and review them on a monthly basis. We give them medication on a monthly basis. And now, the adherence from home, some of them is not good. They don't follow the right time for medication. And that is something that we really need to organize and sensitize the parents of these children.
The nodding syndrome situation has been reported to Parliament, and the Health Committee says it will be brought up for debate and a resolution is reached. For now, victims are hoping a cure for the disease is found so that their lives return to normal. Isabel Nakiria, CGTN Omoro, Northern Uganda.